Alcohol can cause many problems throughout the entire digestive system, from the mouth to the colon. Even a single instance of binge drinking can damage various parts of the digestive tract. Alcohol abuse damages the salivary glands and irritates the mouth and tongue, leading to gum disease, cavities, and in severe cases, tooth loss. Heavy drinking causes esophageal ulcers, acid reflux, and heartburn, and it is also a major cause of stomach ulcers and gastritis. Damage to the digestive system can lead to symptoms such as gas, abdominal bloating, and diarrhea, and internal bleeding due to ulcers, hemorrhoids, and esophageal varices caused by liver cirrhosis may also appear. Alcohol prevents the digestive system from properly absorbing nutrients and B vitamins and disrupts the balance of intestinal bacteria. Consequently, alcoholics often suffer from malnutrition. In particular, heavy drinkers have a high risk of developing oral, throat, and esophageal cancer, and the risk of cancer increases even more when smoking and drinking are combined. Even a single episode of heavy drinking can cause heart problems. For those with alcohol dependence, the possibility of heart problems occurring is much greater, and women who drink, in particular, have a much higher risk of heart abnormalities than men. Complications in the circulatory system include cardiomyopathy, arrhythmia, hypertension, stroke, heart attack, and heart failure. Diabetic patients, especially those using insulin, face an increased risk of hypoglycemia. Additionally, deficiencies in vitamins B6, B12, thiamine, and folate lower blood cell counts, causing anemia, the general symptom of which is fatigue. Erectile dysfunction is a common side effect in men who abuse alcohol. Alcohol abuse suppresses hormone production, affects testicular function, and can be a cause of infertility. Heavy drinking can stop menstruation in women and lead to infertility, and it increases the risk of miscarriage, premature birth, and stillbirth. In particular, alcohol consumption by pregnant women has a massive impact on the fetus, causing a series of problems known as Fetal Alcohol Spectrum Disorders, or FASD. These include deformities, learning disabilities, and emotional problems, which can last a lifetime. Women may also have an increased risk of developing breast cancer due to alcohol consumption. Regarding the impact on the musculoskeletal system, long-term alcohol consumption hinders new bone production, increasing the risk of osteoporosis and fractures. Furthermore, muscles become weak and cramp, and in severe cases they may atrophy. Next is the immune system, our body's defense system. Alcohol abuse weakens the immune system, reducing the ability to cope with viruses, bacteria, and various diseases. People who drink heavily are more susceptible to pneumonia or tuberculosis than the general public, and chronic drinking further increases the risk of developing several forms of cancer. Drinking habits progress slowly and can lead to alcoholism, a chronic disease. In this process, all organs of the body lose vitality and suffer damage. Alcoholism is not just a habit, but a disease accompanied by structural abnormalities. Alcohol damages every tissue it comes into contact with. It can cause direct chemical inflammation in the esophagus or weaken tissues by inducing acid reflux and cause inflammation and bleeding in the stomach lining. The higher the alcohol concentration, the more severe the damage to the stomach lining can be. In the small intestine, the power to delay the movement of food decreases, which often leads to symptoms of diarrhea. In the liver, alcohol interferes with the conversion of amino acids to glucose and stimulates the synthesis of certain proteins, increasing triglyceride levels in the blood. This leads to the accumulation of fat in the liver, resulting in fatty liver, which in severe cases can cause liver failure and death. Continued binge drinking can progress to liver cirrhosis. The impact on brain nerve cells is also serious. Alcohol disrupts the function of neurotransmitters, hindering information transmission, and interferes with the mechanism of electrical changes in nerve cell membranes, causing problems in neuroplasticity. This leads to a decline in brain function. Additionally, alcohol consumption causes heart enlargement, abnormal heart problems, edema, enlargement of the liver or spleen, heavy breathing, abnormalities in the cardiac conduction system, and disorders in heart rate and electrocardiograms.